Medicare is a federal health insurance program available to most people age 65 and older, and sometimes to those under 65 with disabilities. Medicaid is a public assistance health insurance program available to low-income or disabled people regardless of age. Medicaid is a joint federal and state program where the federal government requires every state to offer certain benefits. Each state runs its own Medicaid program and determines eligibility requirements. How do you know if you qualify for Medicare or Medicaid? Let's get help from our friends Bob and Susan. Bob just celebrated his 65th birthday and is looking forward to retirement. He isn't disabled and is not considered a low-income earner, so he is eligible for Medicare, but not Medicaid. Bob can get his Medicare coverage directly from the government or from a private insurance company like Humana that is contracted with the government to provide Medicare plans. Susan is 52 and is considered a low-income earner, but the state she lives in has additional eligibility requirements for Medicaid. She recently had an accident that left her with a disability. Because Susan is disabled and a low-income earner, she meets the requirements for her state's Medicaid program. Most of her health costs will likely be covered, even though she isn't 65 yet. Susan might be eligible for both Medicare and Medicaid due to her disability. Depending on the state, Susan may be able to get her Medicaid coverage from a private insurance company like Humana.